Hi everyone, Dr. Late here, and today we're going to be continuing on some education for you as to what you can expect if you have a big pain event happen. So a big pain event, right? You woke up and you can barely move your neck, you reached down to get something and you threw your back out, you're at the gym, you got this big pain when you're doing a lift or a stretch even. What is going on there? Well, in that event, what we call that the acute inflammatory pain. So what's happening during that time? So firstly, the first 3 days after you get that injury, your inflammation is going to be up, which means your pain is going to be up, and your movement is going to be down because your brain is it's going to spasm muscles, it's going to try to keep you from moving a lot in that area because it's reading that inflammation as damage. So because of that inflammation, your brain says this area is damaged. We need to keep that area nice and safe and keep you from moving it too much because I don't want there to be more damage for you. What can you do if you have that big pain happen, if you have that injury happen? You can go see someone like me, like a chiropractor, you can go see a massage therapist or acupuncturist, and there's something that you really need to know if you go see anyone who's going to be doing a treatment for you based on pain. And you need to know that during that first 3 days, there's 3 different outcomes that can happen. And this is pretty much what all the studies say. You're going to feel better, you're going to feel worse, or it's not going to make any difference at all. So why would you even want to go see someone like a chiropractor coming in here to Alameda Chiropractic and Ergonomics if you never know what's going to happen? Well, the first thing you need to know is that we're going to be talking with you about what's going on. We're going to be ruling out any big bad things that we might need to send you somewhere else for to get a more in-depth assessment. And we're going to be doing treatment for you that's based on what's probably going to help you the best at this time. Now, if it's the very first day after you get an injury, you woke up that morning and your neck, like you can barely move your neck, doing an adjustment for you, depending on how you're able to move already, might actually make the situation worse. But we have other tools that we can do to kind of help relieve some muscle spasm to get a little bit better movement in there. We can do traction, different things like that, to make it so that you can move a little bit easier and help that pain go down. And in addition to that, we can get you a plan. We can set up a plan for you. Okay, we're going to do this, we're going to do this, we're going to do this, we're going to do this for this amount of time, etc., to make sure that we give you a roadmap to recovery so that you can, as quickly as possible, get back to the things that you want and you need to do without having that pain, and then giving you another plan, right? Giving you a plan to help create a foundation so that you're not going to have that pain over and over and over again. So just so you know, if you've ever had that experience where you went to see someone after you had some pain, the first couple of days after you had that pain and it didn't help you, just know that that is a normal response to have happen. Sometimes it's helpful, sometimes it's not. We just need to find the right combination of things that's going to help you. So I hope that kind of explains to you, what may have happened to you in the past, or it gives you a plan if that big pain happens in the future. And of course, if you like this information, like, follow, and share us here on this platform. And that's it for me today. Always love talking with you, and we'll see you next time. Have a great one.